Hi, Don here. Welcome to Podiatry Practice Mastery, where we're helping you bring your practice to the $1 million mark and beyond in your individual production. This is a recording of a Thursday here in the office. Okay. So first patient was a matrix follow-up. They also had some peroneal tendon pain. That's why I did this follow-up. So usually it's a 3-week follow-up. I'm starting to use these in 10-minute slots versus the 20-minute slot, but this is a quick follow-up. She's doing fine. Her peroneal tendons are doing fine. Next patient came in. She had a painful neuroma, and staff did an x-ray, we did a ultrasound, and we did a neuroma injection for this patient. She'll follow up as needed, if needed for that. Next patient was a 42-year-old. She had Achilles tendonitis. She's going to do the initial treatments, foam rolling, morning stretch, shoe changes, things like that. If it's not better in 3 weeks, then I discussed with her about doing an ultrasound and doing shockwave. She did not jump directly to shockwave because she really hasn't had pain that long. It's only been about 3 weeks. Next patient was a 14-year-old, came in, brother and sister. They both got matrixectomies, left toes, both edges, both of them. So I did both of them. Next was a 68-year-old female, plantar fasciitis. They did a foam roller, morning stretch, and she'll be coming back in 3 weeks to see how she's doing with that, anti-inflammatories. Next patient was a 34-year-old guy. He came in for a wart that's been there for years. He did number 3 out of 3 for Swift. It's totally gone, so I'm not doing the fourth one that I usually do with Swift. I'm going to do a 3-month follow-up, him in a 10-minute slot. Next patient was a 3-week matrixectomy follow-up. She's doing fine. Next patient was a patient with some FHL, kind of pain, tendonitis, 71-year-old, kind of pain a little bit distal to the kind of the heel, kind of arch region. And in that it was proximal to the first med head region. Kind of weird type of a pain, so I did an ultrasound-guided cortisone in that area to see if it'll kind of calm it down for him. So I'm going to see it back as needed. Next patient is a 69-year-old. EPAT follow-up. Her heel is doing much better. She did have a neuroma on the right third, and I did an ultrasound-guided cortisone for her. She's going to follow up as needed. Next was a 62-year-old. She had a lateral heel pain, which is not all that common. But there was really no medial heel pain, so we did the Pelto Special, night sprint, foam rolling, morning stretch, cortisone injection laterally with ultrasound. There was some thickness in that, and also she was a patient that I saw her a while back, and she did bilateral Onyfixes, and it's been about 9 months since I've seen her, and her nails look really, really good. So she did it more because they were ingrown and a little onycholytic, and they're looking good now, so I took off those Onyfixes. So they usually don't last that long, but hers did. I don't do a ton of Onyfix. I'd love to know if someone else does a lot more than I do. I do it occasionally for patients, but I'm tending to still do the procedures versus the little pieces of the plastic thing I put on the toes. Next patient was a 64-year-old, Achilles tendonitis, equinus. Shoe recommendations, Pelto Special, which is night splint, morning stretch, foam rolling, anti-inflammatory shoes. She'll be back in about 3 weeks. If it's not better, we'll go ultrasound and then shockwave. Next patient was this is kind of the stressful one of the day. She tried to call multiple times in the morning, didn't get through, went to voicemail, right, and then it transcribes, and our staff never got back to it for like a couple of hours, and so she did come in. I avulsed her toenail. She's going to go on vacation tomorrow. She needed to be seen, and unfortunately this is the challenge we're having, and actually the real challenge is that I think I told you my staff are turning down the phones, so they don't want to answer the phone, so they're turning them down. It's not a good solution, but it bugs them too much, they say, when they're with other patients. But we're like, how do you do this? So one of the solutions is we might not have enough staff answering the phones in busy times, so we're going to have a virtual assistant. We're training them right now. They're going to be answering the phones, but they're also going to be answering all these like virtual messages as well. Next patient was a 29-year-old. She was a rock climber, and she had a fall and kind of impact pain, and so she has pain around a subtalar joint. Nothing really showed up on x-ray, but I'm going to get an MRI to see if there's any bone marrow edema in that region. Next patient was a Lamisil follow-up. She's doing fine in her toenails. No need for follow-up for her. Next was a patient that I did Cantharidin on, and she wanted to know something else she could do. So for her, I gave her imiquimod as a prescription as well. So I added that on. Just gave another office visit with that. I tend to do combination, so something topically like Cantharidin along with something topically, just because the patients feel like they want to do something. So I did that. Next patient was a 52-year-old that had tinea pedis. I did ketoconazole, and I'll follow up with them as needed. Next patient was a gout follow-up. I did a cortisone injection about 3 weeks ago. He's feeling much better. Really, really happy. Next patient, there were a couple of other patients. So there's one patient that, interesting, he had before an exostosis between the fourth and fifth toes. Before he had a callus. This time he didn't, but when I felt between there, he had like an induration of skin. So I explained again the anatomy, the need to potentially take out that bone, the proximal phalanx of the fifth digit. He didn't want to do that. He's been doing anatomic shoes and kind of lamb's wool. He's been doing better with that. But he is now he's feeling better for that. So that was kind of the day. I'm still kind of working on, as I mentioned before, kind of utilizing my time in the office to make YouTube short videos. So short videos, 1 minute videos, or like 1 to 3 minutes for YouTube shorts. And then they're working well. My staff or my virtual assistants are putting them up on YouTube, but I'd like to repurpose them to like Facebook, Instagram, other places like that. I'm not doing that currently. I would love to know if anyone else is doing that, if you're getting success in getting patients in that way. That's something I'd like to do. So I'd love to know. And if also someone is really good at doing ads and stuff like that, I'd like to learn a little bit more about that. I'm kind of following this Alex Hormozian. I feel like to fill up the new doctor, I'd like to do more ads to get patients in. My struggle right now is if they're not answering the phones and I'm going to be paying for ads, then it'll just be ads I'm paying for that they're not answering the phone. So I feel like I have to fix this phone thing first. Okay, you guys have a great day. Shoot me an email, Don at podiatrypracticemastery.com if you have any great ideas, tips. Okay, until next time.